start the symposium for today. I welcome everyone, and I declare open the works of our 8th symposium regarding beer and health. I think most of you have been here also before, because you know these symposiums are taking place starting from 1999, every 2 or maybe 3 years. I remember very well the last one. It was very, very interesting. I still have my mind on some research I've heard during that occasion. My name is Corina-Zugravu, and I'm going to be the chair. It sounds very pretentious, but it's not. It's actually some kind of a burden. And I will guide you through the works of our symposium. As you well know, we are going to focus on the effects of the moderate beer consumption in the healthy adults' diet. Some time ago, I think in 2008 or 9 or something like that, I happened to read a huge book with gathered different scientific research regarding beer drunk in moderation and the correlations of this type of beer consumption and health. And I wondered, so much research, I have never ever heard of something like that before. Because if the misuse of beer is largely known, unfortunately we have very rare occasions to read research carried in the area of beer and health. And this is what this kind of symposiums is going to try to show you. And afterwards, I think you will maybe know more about the research that is carried out and that connects very well beer and health. It might seem a little bit awkward to link beer and health, but research is showing us that this is happening, and there are a lot of ingredients in beer, including alcohol, that can be very well connected with a healthy outcome. We already know that there is a J-shaped curve linking alcohol consumption and mortality and morbidity of cardiovascular diseases. We will hear a very interesting presentation regarding cardiovascular diseases and health. There are also some other diseases in which the beer consumption is not at all banished. On the contrary, it can bring some very interesting positive elements like diabetes, type 2 diabetes, and also some diseases that are linked with old age, like different types of dementia. From the start, I have to underline that we are not going to praise here alcohol consumption. We are not going to encourage people to drink more in order to be healthier. This is a reproach I frequently hear. No, we are going to refer just to moderate beer consumption with the remark that, of course, there are persons that have different diseases, or there are women, pregnant women, lactating women, or small children, or bigger children, or adolescents, which are not at all advised, by all means, to drink any alcohol beverage, including beer. Of course, beer has another advantage. We have also an alcohol-free alternative. So if you like beer, you can drink it without alcohol. Okay, then I remember very well that some time ago I read a nice book which was named The History of the World in 6 Glasses. And among those 6 glasses that follow us through history was also beer. Obviously, it was not the only one. And it was quite interesting because you see our connection with beer is not something new. We drank beer for a very long period of time. I even believe that part of the wage of the people working to pyramids was paid in some kind of beer, the historical beer that they drank then. So it's quite interesting because we are living in a modern world and we are drinking something that our far ancestors were drinking. So in this context, I recently read a very new edition of National Geographic, which was concentrated on booze, on our historical relationship with alcohol consumption, This edition was endorsed by Mr. Curry, which will have also today a very nice presentation, which I think is named Beer on Our Mind. And I give the floor to Mr. Anthony Curry for this presentation.